Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, a big conviction. Senator Fumo convicted 137 counts. We got a new entrant into the gubernatorial contest, a health care update. What more could you ask for? Back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. All right, we have two of the state's leading journalists in to talk a little bit about a gubernatorial run, Senator Fumo convicted, that and more. Joining me, as often is the case, sitting right across from me is Amy Worden with the Philadelphia Inquirer and Tony Romeo, KDKA and KYW Radio. All right, I want to start right off the bat with you, Amy. You wrote a big story this week. The Attorney General of the state of Pennsylvania does he got his toe in the water? How would you describe that for governor? What happened?
Yeah, I'd say it was more than a toe.
More than a toe.
Go ahead. At least his foot. No, more than that, I would say. Yeah, if it quacks like a duck, it's probably a duck, kind of thing.
Right.
Yeah, he announced that he had filed paperwork that allows him to form exploratory committee that allows him to raise money. Along with that, were some even, I think, bigger signals, which is that he's aligned behind him some of the most powerful Republican fundraisers in the state. I'm talking about Bob Asher, Republican National Committeeman, and several others who
Christine
Toretti, yes,
yeah.
who are power brokers.
Major power broker in the Republican Party. Go
ahead. And of course he's the two-term Attorney General now, biggest vote getter, Republican vote getter last fall. He came through when Republicans were falling all over this country. So he's got a lot of momentum right now to run on in a wide open race.
Yep. All right, now. One of the possible rivals for him is a guy named Pat Meehan. He's a former U.S. attorney who resigned, I think, last August, just before what trial began?
Yeah, what a curious development that on the same day that the high-profile investigation, probably the highest one in the state, second only, or Corbett's investigation of the legislature being second only to the investigation of Senator Fumo, former Senator Fumo. Pat Meehan, the man, former U.S. attorney who brought that case, essentially, resigning just before the trial began. On the same day that trial produces a conviction, Attorney General Corbett announces his exploratory committee.
Yeah. So what we have here now is, let's see, we have Senator Fumo convicted, 137 counts. We've got a former U.S. attorney who, in a sense, put the case together but didn't try it, Pat Meehan, also likely to run for governor, one from the eastern part of the state, one from the western part of the state. Well, Tony, what are the ramifications of this Fumo conviction? I mean, he's gone from the legislature. One of the most powerful guys, I think everybody would admit, involved in so much legislation. It creates something of a power vacuum. What do you make of all that?
Well, certainly, yeah. I mean, I don't think you're going to see anybody like him. I don't see anybody like him on the horizon.
Yeah. Now, you interviewed him many times, right?
Sure, yeah.
I mean, a real genuine personality, bright.
Oh, yeah. I mean, well, certainly, I think I can state without a doubt. I don't know whether there's anybody of his stature to step into the power vacuum, but there's not going to be any character probably like him, quite like him, on the horizon for a long, long time. But you don't see anybody like that, I think, stepping into the void, at least not immediately.
Yeah. Amy, on the issue of, we're linking these two together. We've got, Corbett. Everyone expects a pretty competitive governor's race on both sides of the aisle. I mean, every sense of this is that there really is sort of no clear favorite. Or, as a journalist, and you cover these folks, does it look like we're going to see real competition in both parties for the governor's race, sort of like we've seen, every now and then, like 94 and 78 again? What's your sense about that?
Oh, for sure, yeah. The Democratic side is also a growing field crowded with entrants from all four corners of the state almost. and some names slightly more recognizable than others, but most are still sort of more regional based in terms of their recognition and that sort of thing. But yes, absolutely, it's still very fluid about who's going to be
on the Republican side. I think the interesting thing to me is that it seems to me that two of the candidates, Jim Gerlach, the congressman from southeastern Pennsylvania, being the other name in the mix, they have, I think, a high profile in the southeast, whereas the Attorney General sort of has more of a statewide name. Obviously, the results of the election in November are a testimonial to that.
And Amy made a good point. I mean, Barack Obama won Pennsylvania by 10 percentage points. Corbett swam against that tide. I forget, maybe 2-3 percentage points he won by, but he won. And he even carried some of those counties, like down in the Philadelphia area, in spite of this. Go ahead.
Yeah, well, after an early surge by his Democratic opponent, he came back in the end to solidly win it.
So yes or no on this? Both parties look like they have competitive primaries coming up next year.
Sure.
Tough, hot race. You agree?
Yeah.
You agree?
Oh, absolutely. Especially, I think, on the Republican side. I think the two personalities, the two figures, me and Corbett, squaring off. Where they've got both have these high-profile investigations that have been in the news, and I think even though the Fumo case is ostensibly concluded, that's still going to be producing headlines.
Yeah, well, it's a little more delicate for Corbett than Meehan. Meehan's case is more or less, for now over.
You're right. I think that's an important point. The fact that he is going to be now in somewhat of a delicate situation going forward.
Corbett.
Yes,
Corbett.
Particularly since he has brought charges against 12 people,
all Democrats
so far.
But he has said, in fact, on this program, he has said that he being Corbett, that there will be additional indictments.
Right.
Will be additional indictments. Now, everyone assumes they're likely to be Republicans because the investigation has moved to the House Republicans. I don't know about the Senate Republicans, but they've provided additional information. Is that essentially correct?
Yeah, right, although I don't think he's closed the door.
And I think the thing is that everything he does, no matter what he does, is going to be scrutinized. I mean,
you're right.
You got a lot of scrutiny on more Democrats, including former leader DeWeese.
Right.
If he brings more charges against Democrats, I'm sure he's going to.
You're right.
He's going to
so
hear about that.
There's an upside and a downside, is what you're saying to what's going on. All right, we got to get out of here. We're going to break. We'll be back. The stimulus package is being debated. Who's right, who's wrong? The legislature wants more involved in it. We'll be back with that and more following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to the program with Amy Worden and Tony Romeo, journalists all right, look. I'm gonna say something that maybe a host shouldn't say, but if we didn't have a strong independent press and radio and TV and newspapers, you wouldn't know what we know. Fumo would not have been probably even the subject of investigation, not been for your work, the work that your newspaper did. We had the Post-Gazette and the PatriotNews and the Trib Review doing the stuff on Bonusgate. Without that, I don't know that it would have gotten as far as it did. But having said that, Fumo, 6 years in the making. What do you think of that before this trial comes to pass?
Yeah, well, something that struck me in reading some of the comments by the lawyers who brought this case, the prosecutors that brought the case, is the comments after the verdict were, we hope this sends a powerful message. How many times have you heard that, right? But this case has been hanging around for 6 years, and how many public officials have we had charged, indicted, convicted? I'm thinking of the former House Whip Mike Vion. I'm thinking of the judges in Luzerne County. Thinking of former Representative LaGrada. I mean, we have a string of
at least 8 or 9 within the last 10 years.
Exactly. No one's getting the message. Will they get the message now? I don't know. But everybody's making noise about things we need to do moving forward.
Did you want to add a comment
Just
to that?
the idea that everybody said the same thing after the pay raise and the backlash from the pay raise. Oh, we got the message, and I think a lot of people would say that some of the old habits of the legislature are
they get the message for a couple of weeks. Is that your point? All right, look, Tony, I want to start with you on, we're in this debate about the stimulus package and who gets to control the money and where it goes. Give us a quick update on where you think all that stands.
Well, where it stands right now is that tensions are starting to ratchet up between the legislative Republicans, their leaders in particular, and Governor Rendell over control of the money.
Oh, gee, surprise, surprise.
Just this week, the leaders of the Republican caucuses in both chambers sent letters to the governor saying, hey, we want more input, we want more information about how this money is being spent. The governor responds saying, hey, basically how this money is to be spent has been sent down from the mountain on tablets from the federal government. It's all prescribed.
It's in that 1,000-page bill that nobody's read.
But I think going down the road here, you're going to see some tussling over, hey, who controls the purse strings
Go ahead, Amy.
Right. Well, one interesting thing about the governor is that initially, when as it became apparent that yes, there was going to be a stimulus bill, the governor was saying that when we asked him who was going to be in charge, as other states were appointing stimulus czars or commissions or independent bodies, he said, "I am." And then suddenly, a few weeks go by, and the chatter starts to get a little louder about transparency and accountability. And then suddenly he's saying, "Oh, we're going to have a website," which apparently was mandated. And now he's talking about a loose committee of leaders in the various caucuses that he will, that will be brought in for consultation. But others like Senator Brubaker are saying we need a formal commission that is going to review these.
And I don't want to be a henny penny here, but it does sort of look like things are setting up for a brutal summer with the budget. I mean, it was going to be difficult already with a budget deficit projected at $2.3 billion and maybe going to grow. But then you add the stimulus
and they want
to
know where the stimulus is going, and it should be approved as part of the budget process again. I guess that's all in the making, right?
Yeah.
Well, specifically, the House Republican leader, the leader of the House Republicans yesterday or this week came out and said he thinks the governor should redo his budget, submit an entirely new budget. Because of the stimulus money.
Great update. Oh, by the way, next week we'll have Senator Brubaker on. He's going to talk about that legislation of his along with Representative Shapiro, who has a cell phone ban bill in the legislature. You're going to want to watch that show. Coming up now, Jim Redmond's in the House. He's going to talk about $4 billion in monies that were coming to the state for health care and the probably more than that, but Jim will tell us. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, we're talking about the stimulus package. At least $4 billion plus are in the $16 billion stimulus package coming to Pennsylvania. Healthcare is a huge part of it. I've asked Jim Redmond from the Hospital Association to come in and chat with us a little bit about it. Jim, welcome as always. All right,
thank you, Terry.
Let's talk a little bit about this. Go through for our viewers what's in this package that matters to Pennsylvania where healthcare is concerned.
Sure. There's really three parts to the federal stimulus bill as it relates to health care. The first and the largest part is what you mentioned, an increase in the federal matching dollars for the Medicaid program, $4 billion over the next 27 months. The second piece is $19 billion nationwide for health information technology. And it's really kind of interesting because it's an indication of the Obama administration's attempt to kind of move toward healthcare reform, recognizing that we've really got to get into the electronic age in terms of medical records and order entry systems and other systems. And the third part is the extension and subsidy for COBRA coverage for people who
that's pretty
lost their job, and the government will subsidize that, I think, up to about 65% of the cost.
Yeah, look, some of these are pretty important. Let's talk about COBRA. I think our viewers, this is something that a lot of our viewers, some of our viewers anyway, might be able to take advantage of. You lose your job, you pick up COBRA. It's the coverage that follows your loss of job. So far, so good.
That's right. I mean, it's your employer's health insurance coverage that you can extend, I think, up to 18 months. Now, you have to pay for it out of your own pocket.
But COBRA does what? Or the stimulus package does what with COBRA? This is important.
It will subsidize the premium up to 65% of that. So
for a period of time.
For a period of, I believe, 18 months.
Yeah. So in other words, this is important. If you're having trouble with your employment, you lose it. The government will assist you in paying your health care benefits, the current benefits that you get with your employer. Are COBRA benefits different? Or would it be your
they're the same benefits. It's
same
the same
benefits
program.
as your employer has.
Right.
All right. That's pretty important, and that's not been widely reported, I think. So good point. All right. Let's go to the second aspect of this, and that's this technology business. We hear an awful lot about some medical errors produced by, I hate to say this, poor handwriting, and doctors will scribble things, and I have the worst handwriting in the world. But is this what that's aimed at, kind of getting these in a position so that the instructions are clear? And
well, it helps,
go ahead.
But it's really more than that. It's, if you've got a chronic health care condition, there's going to be more than one health care professional taking care of you. And using electronic means allows for various health care providers to get up-to-date information on lab tests, radiology tests, or the treatment protocols that other health care providers have provided. So it's a quick way, an efficient way to get up-to-date information on one's health care condition. And if you were to get ill and you're not near your family physician or hospital, it allows that health care provider to access information about you so that they know how to treat you.
Yeah. I mean, and eventually that may even be in a file or some way where the patient can have it available, so that if you end up going in for treatment, you can immediately provide it. Who knows? Maybe be on a BlackBerry, right? You can just
or a chip under your skin.
Yeah, I was going to say. I mean, that's a good point, because sometimes inadvertently physicians will not have a clue. How about if you're in an accident or something and you're unconscious, or you're not in a position, or there's no go ahead.
They don't have information about any allergies or any problems in terms of drug reactions. So, a lot of folks have the wristbands, the medical alert. But this is really provides a lot more information. So, under the stimulus package, the Medicare program will pay hospitals and doctors an incentive payment if they comply with the law. They'll do the same through the state on the Medicaid program, and then they're also making available grants and loans for people to acquire the software and the hardware necessary to operate these systems.
All right, we're talking with Jim Redmond. We're getting an update on the stimulus package here, the part of it anyway that deals with health care. We'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business, with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. Jim Redmond is with us. We're doing a very important update on the federal government's health care stimulus monies that are coming to the state. All right, Jim, I want to talk about, before we go to medical liability quickly, Medicaid, why, it's health care for the working poor. Is that a good way to put it? No,
not really.
No, it's for the poor.
It serves about a little less than 2 million Pennsylvanians who are generally elderly or have chronic illnesses, cannot work, or cover very low income children. So.
Yeah, I was thinking actually of the adult basic, which is the medic. Go ahead.
That's the next step up.
Okay.
Adult basic, those individuals make too much money to qualify.
The host misspoke, but you corrected me. Very good. Now, what does this mean for the 2 million folks that are on Medicaid in our state?
Well, the Medicaid program is jointly financed through the federal government and state government.
Right.
Currently, the state puts, for every 46 cents they put in, the federal government puts in 54 cents. Under the stimulus plan, that changes to 39 cents to 61 cents. So it's an increase in the federal share going to the Medicaid program for 27 months, starting, and it goes retroactive back to October 1st of 2008.
So it saves the state money. Now, what is the state? Must the state continue to put in the same amount of money that it did when it was getting 49?
The only requirement that is in law is that they cannot change eligibility for the program. But in order
to enlarge it?
They can enlarge it.
They can't reduce it.
They cannot reduce it. They can change benefits. Currently, there are no plans to do that. Now, one of our concerns is that the governor did propose some cuts in the state budget to the Medicaid program. We hope that these federal monies will help solve the problem of closing the budget gap that we face here in Pennsylvania.
Well, let's talk about one other aspect before you go. Over the years, when you've been on and others been on a program, we talked about medical liability. State had taken some steps. The insurance situation seems to be a bit better for doctors trying to obtain medical liability coverage, at least. But we still have the state providing a coverage for the physicians in this $500,000 to $1 million in that coverage range out of a fund called the M-Care Fund. Where does that all stand these days?
Well, the governor proposed to retire the M-Care Fund, something that we support, by the way. One of the concerns about retiring the M-Care Fund is that because of the way in which it's financed, it's on a pay-as-you-go basis. So when you require physicians and hospitals to buy insurance at higher coverage limits, that's going to cost us more. But at the same time, we're going to have to pay off this $1.8 billion in unfunded liabilities that is accumulated in this fund, and we're looking for ways to pay that off.
All right, great update as always. Thanks for coming on. We'll see you next week for another program, and as always, stay well.